The SCAN Television Network, in association with Care One and Monmouth Medical Center, RWJ Barnabas Health, and New Jersey Natural Gas present Caregivers First.
Hello, and welcome to SCAN TV's second TV program called Caregivers First. I'm your host, Lynette Whiteman, and our show provides caregivers with information and resources for caregiving, including topics such as legal issues, health insurance, physical wellness, nutrition, and other timely topics. Our guest today is Dr. Evan Rubin from Visiting Physician Services. Welcome, Dr. Rubin. It's so nice of you to be here today.
Thank you, Lynette. Thank you for inviting me.
You're welcome. So before we get started, tell me about Visiting Physician Services. I know that our agency refers to you all the time. You're a huge help to us. But tell our guests what Visiting Physician Services does.
I'd be happy to. Visiting Physician Services is we've been making house calls for geriatric patients for over 20 years. We're now the largest house call practice in New Jersey for geriatric patients. We have 8 physicians and almost 30 nurse practitioners and physician assistants. We cover almost all of New Jersey, more than 10 counties, and we make over 3,000 visits a year. We are able to provide care for, like I said, for all those patients, and it's very comprehensive care. We provide the ability for patients to stay at home, be comfortable. Oftentimes, as people get older or they have chronic illnesses, multiple chronic illnesses that keep them at home, it becomes a greater burden, not only for themselves, but caregivers also, to get them out to see their doctors, specialists. And by being able to go into the home, provide not only the primary care, but we can also come in with diagnostic testing, do x-rays and ultrasounds, do blood tests, and really provide a high level of comprehensive care for the patient and keep them happy, comfortable, and at home.
What a comfort it is for people to know, because I know it gets to be very hard after a while. People with mobility issues or cognitive issues, they resist going to the car, or the caregiver themselves is old. So what a comfort it is for people to know that the doctor, it's an old-fashioned concept, that the doctor is going to come to the home. It's such a nice service that you're providing to people.
Yes, and it's nice. Like I said, it's a lot of the patients that we see, they remember when we come into the house, they remember when they were a child and the doctor came into the house, and so there's a familiarity there.
Yeah, that's lovely. And so we're talking about caregivers. That's the focus of our program. And so when you must really get such a good sense of what's going on in the home in a real true sense. I think when people go to the office, they're dressed and they're ready and it's a different sort of setting. But when you're going into the homes and you're dealing with caregivers and seeing them, what are the issues that really you see mostly, or what are the things that you really pay attention to when you're seeing somebody who's a caregiver?
Well, one of the benefits of making the house call is, just as you said, it's not an office visit. I don't have a time frame of 6 minutes or 8 minutes where it's in and out and it's a very narrow window. I can see what the environment is like. I can see how the caregiver interacts, what level of health the caregiver also, has. A lot of times these home visits, the discussion, the communications oftentimes is with the caregiver. And of course the exam is of the patient, but the communication, going over some of the plan, going over certainly some of the issues, what the history is and what the reason we were called in for the visit is usually through a caregiver. And you can get a sense of how involved they are, whether they feel on top of it and organized, whether if they're beginning to start to get a little bit overwhelmed or unsure about some of the questions we ask. How long has this been going on? What have you done? What's been done previously about it? So having that interaction, having that conversation with the caregiver as well as the patient really gets a more holistic sense of what the condition is going on, and that really can help to to play into what the prognosis is going to be and what the course of treatment will be.
That's great. One of the calls that we get all the time is from adult children or a spouse who's really worried about the person that they're taking care of. But the person they're taking care of is in denial about it. I don't have a memory problem. I'm not falling. And you want the doctor to know that that's going on, but it's hard to talk about it in front of the patient because they might get angry later or deny it. I know when we took my dad to the doctor, everything was fine. He fell the day before, but everything was fine. So what advice can you give to those people that want to tell the doctor something, but they just don't know how to do it? How can they do that?
Well, the visit begins really with the phone call to my office. We'll get a call often from the caregiver saying, we're no longer getting out to see the primary care doctor. We would like to start with your service. And a full intake happens. We have very competent, very friendly, compassionate people taking these phone calls, doing these intakes. So we'll get not only a list of what the issues are, what the medical diagnoses are, but exactly issues like that. There's a sensitive topic. There's a diagnosis they know about or they don't know about, something they like to discuss or don't, but it's a concern to the caregiver. And knowing that, we'll have that information going into the house, and we can, either avoid some of the trigger words, have a different way of phrasing it, but at the same time, help to be a third party, so maybe there isn't that direct interaction and the emotion there between caregiver and their spouse or parent or whatever, but be able to educate both people on the reality of it, if that's appropriate, or be able to provide support and care without setting off that trigger, even though it's still acknowledging it as part of what needs to be addressed, but be able to make that, to provide that support.
Right. And you mentioned about trigger words and things like that. So would you say something like you're getting more forgetful instead of you're having dementia or something? Like, how do you phrase things softer for people?
Yeah, I mean, forgetful or
Right.
saying, you don't remember as well, or something, or even attention is something that you can look out for. If someone used to read or used to be able to watch a program that they loved, and either they don't recognize it as much or they don't have interest in it as much, what happens, again, both with caregivers and the patients, is in this setting, a degree of isolation sets in. And that's something that we address and talk to certainly the caregiver about, and to help perhaps bring the patient out, but also to themselves to start to really make sure they're engaging in activities and doing some other things that bring them joy, that increase quality of life, and that can help. That can help all of the situations, really, but it especially helps with some of the memory issues,
Right.
and it can help some of that self-realization, for the patients as well.
Right. And do you sometimes see the caregiver is going downhill quicker than the patient because of the stress that the caregiver is going through?
Yes, there's something called caregiver guilt that happens, and there's a lot of times the expectation that perhaps the caregiver has for themselves, or a stated expectation that happened before perhaps an acute episode that really changed the picture, is carried into the situation, and caregivers can believe that we just want to do everything, and there's no limit to what we can do to provide for people we love, and it's there is a limit. There is a tipping point. There is a point where you have to find that balance and manage when it becomes too much. And it's something, again, being in the home, it's something that is more easily recognizable than when everyone gets their best,
Right.
dress on and they come to an office for 6 minutes. We can really tell when the exhaustion sets in, or when their own health, like you said, is kind of sinking. The patient may be stable, but you notice the caregiver is getting a little more exhausted.
Right. One of the things that I tell caregivers, and tell me if it's correct or not, is that I think sometimes a parent or a husband or wife, they don't listen to their kid or their spouse. Like, what do they know? They don't know anything. But if the doctor says you shouldn't be driving, or if the doctor says, you know, you need to walk with a cane, it's not safe for you, especially with that generation, it means more than the doctor said it. You know, it's not me, the doctor said it. And so I tell sometimes children, tell the doctor to say it to them. You take a step back. Is that a role that you are comfortable that you tell caregivers to play?
Absolutely,
Yeah.
and that's great advice.
Yeah.
The things that perhaps seem common or obvious to the doctor. Oh, if they're saying it, it's true, or you should know it intrinsically. Those things being said repeatedly, being written down, little memos around, having easy access to glasses of water, having several different canes, going shopping for a cane, so it's something they like to use. But exactly as you said, having it known, having a conversation with the caregiver so that the doctor can explain some of these things, as obvious as they may sound, they're not obvious to everyone. That and coming from the doctor gives it a little more weight for a lot of patients, and it takes some of the burden and the emotion out of the situation between the dynamic between caregivers and family and patients. Right.
And you mentioned about that tipping point, that often there's a tipping point that you see. Talk to me a little bit about that. Like, what does that look like when you go into a home? What red flags go off in your head, like, this is just not safe anymore?
Well, there are. It can look a lot of different ways. And again, I'm mentioning being in the home. You can look around and see, a lot of information there. And having been doing this for many years, you can look at the cleanliness of the home. From the first time you went in, you can look at the type of food that's laying out on the counters or what's in the refrigerator. One of the largest cues is medication. A lot of times caregivers are responsible for dispensing medication. And this is a tricky thing. There are a lot of things that play into it, whether they've been to the hospital and out, and there are different formularies, medication changes, different visits. There are acute processes that go on that start different medicines and then they're no longer there. And there can be, even for medical personnel, it can be a lot of confusion. It's a complicated issue. So certainly for lay people that aren't clinicians, caregivers, explaining that and keeping track of that can be a major job. And whereas it may have started very organized, and we try to do everything we can with lists and color coordinated things, drawing pictures of what the pills look like, the dispensers that are organized. We notice that, and again, you go to a visit and you go through all these things, if there are skipped days, if some of the medicine is taken or not taken, if there are bottles that are more empty than they should be, if there's big changes to vital signs that may be due to some of those missed medications, that's a big trigger. And again, one missed day here and there happens, but when you start to notice trends, and you start to notice the caregivers themselves saying, oh, I don't remember, showing signs of more confusion about it. Not necessarily cognitive decline, just that being overwhelmed. Those are, again, there are opportunities to start to talk about some more support that perhaps they could look for.
Perfect. Okay, well, thank you. We're going to take a short break now. We're getting such helpful information. It's so wonderful to have a doctor here to be able to ask these questions too. So we're going to take a short break and stay tuned, because we're going to give some more helpful hints for caregivers. Thank you so much, Dr. Rubin, and we'll be right back.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully, without setbacks, at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to Caregivers First. I'm your host, Lynette Whiteman, and today we are so fortunate to be talking to Dr. Rubin from Visiting Physician Services. And Dr. Rubin, we were talking before the break, you mentioned about how important resources are in helping caregivers. Talk to me a little bit about the resources that you like to recommend, or the ones that you really think are important for caregivers.
Certainly. For people that are, again, that are homebound that we go to see, that degree of social isolation that sets in, oftentimes they can become very withdrawn. So getting people to come into the house and rehabilitate them, get them motivated to get out of bed, even though they're still at home. So things that normally other people could perhaps drive and travel to, like a physical therapist, speech therapist, occupational therapy. These are things that in 2015, in January 2015, Visiting Physician Services joined with the VNA, Visiting Nurse Association of Health Group in New Jersey, and now because of that kind of joining together, we can within the same company we have better communication, better ability to support the patients in that way. They're very easy referrals to make. The clinicians, physicians, and the therapists can correspond easily with our notes. We share notes and provide that help in the home.
Wow. So it's really a holistic look at what's going on to somebody. It's not like you're going this place for this and this person doesn't know what's happening here, and so it really, you get a really good sense of the family and the dynamics and what that person needs is what I'm hearing.
And that's the goal, is to keep people happy, to provide the highest level of care that they would get anywhere, really, even in the hospital. A lot of times we can do the maximum amount that's available. And as technology keeps changing, more and more is available. I mentioned before about diagnostic testing, but these other ancillary services, there are behavioral therapists that can come in, there are dentists, there are a lot of people that will go in and do home care that are associated with our group.
Yeah. This is great information, because I honestly think a lot of people don't know this is out there. So I hope that people really hear this and try to look into it to find out how it could help. What's the other sort of suggestions you have for social isolation? I think that's not talked about as much with caregivers, how incredibly lonely they get. And especially with dementia, when you have your spouse there, but your spouse isn't really there. I live with my mother who has Alzheimer's disease, and her conversation is basically very limited now. Hi, how are you? What did you do today? What's new? Nothing. Are you going to be home? That's basically the extent of our conversation. And if I didn't work, or I didn't have my husband, I'm a younger caregiver, it would be so lonely. What do you say to caregivers that are in this situation, that aren't working, aren't getting out?
Well, this is an incredibly important topic, and it's something that oftentimes isn't recognized by the caregiver. All they see is their involvement, their attachment, the emotion they have for their loved one that they're caring about, and that is their priority. And that's that's laudable, and it's a wonderful thing to be able to spend that time with somebody and provide that care. It's something that we talk about, or we try to talk about all the time with the caregivers, to be able to recognize it, to let them know. And sometimes it can be a suggestion through the patient's care, by saying, it would be good for the patient for your spouse or your parent to get out, get out of bed, sit by the window, go outside on the porch on a beautiful day. If they can, go for a walk, and of course that's useful for the caregiver as well. Now, if it's someone who's unable to do that, then what I often like to do is recommend, when they know they're entering into this kind of dynamic, this relationship, where they're going to be spending a lot of time in the home or isolated or just with this other person, to ask a third party, whether it's their spouse who isn't the primary caregiver, or a friend that knows that this is what they're going to be doing, spending a lot of time involved with, to check in on them, to say, once a week or at the end of the day, you know me well, ask how I'm doing, let's, just check in with me to see, because sometimes they will lose that perspective and they will, again, like you said, be isolated themselves. So I think that that's a valuable thing to recognize. It's something that oftentimes people don't think about, or they don't think about it at the beginning, and then they realize that at a certain point, it's become overwhelming.
Right. It's such a good suggestion. When we are helping with caregivers, we have an Alzheimer's program, and the volunteers go in. It's a safe person to talk to and to say what they're going through. So many times we hear, oh, I don't want to complain to my children. They have their own life. I don't want to be a burden to them or whatever. So having this third person being able to be completely honest with and vent and complain or whatever, it's a great suggestion. That has to be really, really helpful to people. Yeah.
And that third party, even if it's someone, again, with the large group that we're in, with the Visiting Nurse Association, home health aides, or friends, neighbors that are familiar with the person, having someone else come in, even for 1 hour a day or a couple of hours a week, for a third person to come in and spend that 1 hour is a much easier task than perhaps that 13th hour or 14th hour of the day for the primary caregiver, or 24th hour sometimes.
And I imagine your doctors and PAs and nurse practitioners, when they go over, well, they'll say an encouraging word to the caregiver, or say something like, you're doing a good job, or I know this is hard. And that is just so important for caregivers to hear. I don't think they hear it enough. And just to have somebody acknowledge it is so important. And is that something you build into your visits and is your staff? Absolutely.
Yeah. Absolutely. I'd say it at the beginning and in the middle and at the end of the visits. When there is support being given, it's a very large picture we're looking at. Obviously we can focus on the caregiver and on the relationship there and this kind of transition in someone's life. But what I know they're certainly making our job easier, providing this level of care. They're making their patients, our patients and their loved ones' life far easier. One of the goals is to keep these people happy and at home, and keep them out of the hospital, which oftentimes is not a helpful place for people to stay, in an acute situation perhaps, but that time going to the hospital, not to mention the expense for the big picture. So that is really the goal, and I say that, like you said, I tell the caregivers all the time, what a fantastic job, what an important job, how lucky their loved one is to have them. So, it's very important.
Yeah. And just on a personal level, you must get really close to the people that you're going to. You're in their home, you're in their life. How do you personally, or how does your staff deal with losing a person, or that when that person passes away and you've been such an integral part of their life? Do you do something as a staff to take care of yourself in those situations?
Well, that's a good question. I mean, we get together and we have conversations often between clinicians. I mean, everyone's available. Almost as medical director, I try to make myself available as often as possible to people when they call, and we can talk about those things. We often get really beautiful letters from families telling us how much they appreciate the care that their loved one has gotten, and how they were involved, and how their mother or father looked forward to the visit, and a smile came over their face when they saw them. And it's very touching, because it's a special relationship. There's an intimacy to it. being in that setting. Is also when there's a couple, a husband and wife that I've taken care of, and one of them passes, and then you continue to take care of the other one. There's something you've been through to kind of together to an extent that is very special, and it is a nice bond.
That's lovely. Well, we're coming to the end, so I want to ask you, my final question is, what advice would you want to give to caregivers? But before you talk about that, please give everybody the telephone number of Visiting Physician Services. Again, we refer to you all the time. I think this is something that's sort of a secret in the caregiver world, so I don't want it to be. So give us the telephone number.
So the number is 732-571-1000.
Great. Okay, wonderful. And that will be on the screen as well.
Perfect.
Okay, so to close out, tell us, if you could talk to the caregivers out there, what advice would you want to give them?
Well, the biggest piece of advice is something we've been talking about all along. It's about finding the balance in your own life. The best way to take care of someone, to keep them as healthy as possible, is to keep yourself as healthy as possible. So have a support system in place to recognize when perhaps you're becoming exhausted, and really do the things that you need to do to remain healthy. Have time out of the situation if you can. Have perspective. Recognize that there are certain inevitabilities to the situation, and you do the best you can. Any involvement, any effort you make is a positive one. But the healthier you are, the better you're able to take care of the people you love.
I think I heard before that somebody said, protect your time. And I think that's such a great way to put it. I think caregivers sort of get just so overwhelmed with what they're doing that they don't protect their time. So just being able to protect their time is just really important. And is there a favorite patient or a favorite thing, a story that you would like to share with us about somebody that really made an impact, a caregiver that made it? You didn't prepare for this, but is there anybody that comes to mind?
There are a number, but I can tell you I hadn't thought about it beforehand. But I saw a patient today, and out in farm country, not far from here, and I've seen them a handful of times. Very wonderful. So there are really two caregivers there. There's the spouse, the wife of the patient I'm seeing, as well as someone else they have in the house, a live-in aide. And they're both very involved, and there's the dynamic between all three of them is fantastic. And today she took me out to her farm, and we kind of looked around at the acreage and talked about some of the things. We talked together with the patient, and you just see the lift that happens when he's fortunate enough to be sitting in front of a window and looking out at his farm.
Right.
And then as we leave, she said, "Oh, I forgot one thing for you," and handed me a bag of fresh corn that had just been picked.
So that really is like old-fashioned doctoring, like the chickens and the eggs. So
absolutely.
Thank you, Dr. Rubin. It was wonderful to talk to you, and thank you for joining us for this show. It's been a really, really informative show, and we look forward to seeing you on our next show. And again, if you have a question, if you have a topic, if you have a guest, please let us know. Please, this show is called Caregivers First, and we really would love to hear from you. So have a wonderful week, and hope to see you next time.